Hello, good day, and welcome. My name is Paulina Pilotes, and for this presentation, I will be talking about my innovation project, Nutritionix App. At this day and age, phones no longer solely serve the purpose of sending and receiving messages. Now we have become more dependent on our handheld devices for other tasks as well. Our phones have become our clocks, notepads, calendars, newspapers, and have become substitute for many more items prior to the digital age. This has led to more creative solutions and innovations in most recent years compared to previous decades in the past. Even in the field of healthcare, there has been numerous innovation that involved our smartphones and that provided solutions in meeting various needs in the industry. One of these innovations will be tackled in this presentation. Diabetes has been known in the medical field as the silent killer, with it being one of the top causes of death in the world. People from all walks of life, regardless of age, race, gender, or socioeconomic status, have been suffering from the disease. If this problem were to be addressed successfully, conditions leading to diabetes and complications from the disease progression would lessen and ultimately mortality rates around the world would drop. Diabetes, which is a silent killer, affects people of all races, ages, and genders. The World Health Organization says diabetes statistics have altered dramatically. Diabetes grew from 108 million in 1980 to 422 million in 2014. Comparatively, low and middle income countries have higher cases. 8.5% of adults 18 and above had diabetes in 2014. 1.5 million people died from diabetes in 2019, 48% before the age of 70. Several periodicals addressed this condition and offered solutions. COVID-19 affected lifestyle and diet, which contribute to diabetes according to Chen et al. 2021 and Ochoa Esteban et al. 2023. Stories like this demonstrates that diabetes remains a concern. Ernawati, Hiwatsutsi, and Utami's 2021 journal on self-management and intervention through education yielded positive results, but additional system would be ideal. Pavlidou et al. Examined low and high carbohydrates diet. While the intervention resulted in weight loss, the conditions returned to normal after the intervention period, highlighting the need for a tracker to monitor food and lifestyle choices. Let me discuss these four articles further. In Chen et al. 2021, the article entitled Dietary Habits, Shopping Behavior, and Weight Gain During COVID-19 Pandemic Lockdown Among Students in Private University in Selangor, Malaysia. It aimed to assess dietary patterns, food preferences, shopping behavior, and weight gain during the lockdown among students in a private university in Malaysia. This article is pretty relevant because it talks about the lifestyle and diet, which are two of the main things that cause diabetes in people, as well as how the COVID-19 has changed these things. There were 426 people who answered, and 55.9% of the sample were women. Respondents filled out a validated web-based survey that they did themselves. Chi-square tests with post-hoc comparisons and planned comparisons were also used. During the lockdown, more than half of the 426 students said they ate more, snacked more, and ordered food online. Students with a higher BMI like to eat meat and drink sweets the most. 45.5% of the people who took part said they gained weight after the lockdown. The second article, Ochoa Esteban et al. 2023, entitled Impact of COVID-19 Confinement on the Health-Related Habits of People at High Risk of Type 2 Diabetes. Its purpose was to determine the impact of the COVID-19 general lockdown on health-related habits and lifestyle choices. This study was based on the ALAS program, an established program for individuals that are overweight, obese, or at high risk for type 2 diabetes, giving the authors a good baseline to work with. However, the program was interrupted due to the social isolation measures brought about the COVID-19 pandemic, and out of 533 participants of the ALAS program, only 387 or 72.6% responded. In the Ernawati Wihatsutsi article, The third article, entitled Effectiveness of Diabetes in Self-Management Education, Diabetes Mellitus Type 2 Patients Systematic Review Literature. The goal of the study was to test the effectiveness of diabetes management education (DSME) in patients with type 2 diabetes mellitus. Using a set of inclusions and exclusion criteria, the authors were able to collect 137 articles, which were then filtered further to 15 articles, which were finally chosen to be utilized for this paper. Through this study, the authors have come to a conclusion that DSME has had a positive impact on the overall health of type 2 DM patients, specifically on lifestyle changes, knowledge of their conditions, and self-care. Pavlidou et al. 2023, the last article to be discussed is entitled Clinical Evidence of Low-Carbohydrate Diets Against Obesity and Diabetes Mellitus. The study aimed to validate the correlations of low-carbohydrate diets and improvement of metabolic and non-morbid health conditions. This study has a more direct connection with the selected innovation, which is the Nutritionix App. Out of the 2,637 electronic literature, 7 of the articles were chosen based on set criteria. The inclusion requirements were as follows: must be randomized controlled trial design, adults participants 18 and above, intervention duration should be at least 1 month, the study must be published between the years 2012 to 2022, and weight loss should be the outcome of the study. Databases used were PubMed, Cochrane, and Embase. Results were as follows. The low-carbohydrate diet group showed a body mass lowering of 6.9 kg, while the control diet group reported 1.1 kg of weight loss. On the other hand, the high-carbohydrate diet group increased exercise but did not lose more weight. Percent decreases in body mass of the low-carbohydrate diet and high-carbohydrate diet group compared to the control group were 7.9%, 3.8%, and 7.8% respectively. Compared to the high-calorie diet group, the low-calorie diet group had lower levels of ApoB and ApoAI. Only the LCD group, or low-carbohydrate diet, showed a substantial reduction in hemoglobin A1C after 6 months. These are the chosen collaborators for this innovation project. The clinical coordinator, as part of the clinic management, she has a say on a full-scale adoption of any innovation, including the use of mobile information technology in our clinic. She can influence on the use of the necessary resources required for adoption. A fellow nurse practitioner. As a fellow nurse practitioner, she can share her thoughts and experience coming from the same level of work as mine. She can vouch for the necessity of this innovation and its impact on our efficiency. Technical support specialist. As this innovation is a technological one, a technical support specialist will be needed when adopting the proposed innovation in the clinic. Connecting or mainstreaming the innovation to the existing system of the institution will require the expertise of the technical support team. My chosen collaborators were all in agreement that the use of mobile information technology plays a crucial role in evidence-based clinical nursing practice. They were all receptive of the idea of introducing and adopting Nutritionix or any other related mobile app. Everyone expressed their enthusiasm and looked forward to any innovation that will make our work lighter, at the same time effectively catering to the needs of our patients and clients. For this intervention to work, the technical support staff would be the most important. They would have to come up with easy-to-use orientation sessions for both patients and clinical staff, like the nurse practitioner. Technical support should also be on hand and ready to answer any questions about the app, especially in the clinic office when it is first being used. Clinical staff will also be very important in making sure this intervention works well and that the right steps are taken based on the data collected by the app. Staff members need to talk to the patients and give them set of diets, and meal plan so that they have a good place to start with their diet. Using the Nutritionix database will make this planning process easier because diet plans can be made based on the patient's demographics, like where they live and how much money they have, making it easier for patients to stick to their diet. The Nutritionix app is a calorie counter mobile application developed by Syndigo. It can be used to input or log any meal or drink that is consumed daily. It has 6 unique features. Number 1 is a smart search. Allows you to search for groceries, restaurants, and other establishments from a database created by dietitians. Number 2, predictive results suggest meals relative to the specific time of day such as breakfast, lunch, and dinner. Number 3 is freeform. Through natural language technology, users can speak or type into the app for searching and other tasks. Number 4 is a user-friendly database. The app has access to more than 600,000 restaurants, groceries, and other establishments created by registered dietitians. Number 5 is create recipes. One can create custom recipes that satisfies their dietary requirements and can be saved for future references. And the last, number 6, Coach Portal. Users' logs can be shared with their coach, dietitian, health professional, and allows real-time review of logins. As mentioned earlier, these features can provide patients with autonomy to create their own diet plan or the possibility to follow a guide provided by their respective healthcare professional. The app is also a convenient way to monitor patient adherence to a certain diet. Nutritionix is a very creative way for people to meet their health needs. It has features that make it easy to plan, record, and keep track of what you eat. This app also gives healthcare professionals like dietitians, doctors, and nurses faster and more detailed access to their patients' food intake. This lets them make better decisions and quick changes to a patient's care plan, more specifically to people who have diabetes. Nutritionix uses the cutting-edge technology of mobile apps, which also shows how innovative it is. The use of natural language technology and predictive result is new to the market, makes things easier for users, and is unique. The Create Recipe feature is also a modern take on traditional recipes or cookbooks that are written on a paper. The app's features are unique because it was made with the help of different groups such as app developers, dietitians, and test groups. Through the Coach Portal, users and their coaches, nurses, or dietitians can work together to reach their health goals. This shows that the app is innovative. Nutritionix is an innovative solution and experience for both healthcare professionals and patients because it has a high level of collaboration, uses modern technology and digitalization, and has a new way to do everyday things. In the references, these are the articles and journals used in this presentation. This has been my presentation of my chosen innovation project, the Nutritionix Track app. Thank you for your time and may you have a pleasant day ahead.